Hello and welcome to the COVID-19 update on Channels Television and Millicent Walker. First, the highlights. Edo mobile vaccination team targets communities on the outskirts of the state capital in the ongoing mass vaccination campaign. Lawmakers harp on strict adherence to COVID-19 safety guidelines, assures of compensation for those affected by pandemic. And South Africa's health minister calls for caution over calls to ease COVID-19 restrictions. Thank you for joining us. In line with the federal government, the COVID-19 task force and the National Primary Healthcare Development Agency's strategy to the mass vaccination exercise, community pharmacists are now approved to be vaccination sites and also to administer vaccines. However, only trained pharmacists and laboratories who are certified licensed to provide the service can do so. This is in conjunction with the Association of Community Pharmacists, State's Primary Healthcare Development Agency, and other partners. According to the National Primary Healthcare Development Agency, so far the pilot stage is kicked off in Rivers, the FCT and Lagos. Meanwhile, the agency says that Jigawa and Lagos states have vaccinated about 1.5 million eligible Nigerians, respectively, with the first dose. Here's more on the pandemic update.
228 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 13 states and the FCT. That's an increase from the figures reported earlier. The FCT accounted for the highest number of cases with 110 infections. Gombe had 38, Lagos 32, Osun 14, while Taraba registered 12 cases. Imo, Kaduna, Rivers, Borno, Kano, Bauchi, Delta, Ekiti and Ogun states logged single-digit infections. The total confirmed cases in Nigeria now stands at 252,187. The report also includes a backlog of confirmed cases from the FCT, Taraba and Borno, a backlog of discharges from the FCT, as well as 0 cases from Edo, Ondo and Sokoto states. 462 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 226,408. There were no additional deaths recorded in the last 24 hours, leading the fatality toll at 3,124. Currently, there are over 22,000 active cases in Nigeria, while more than 3.9 million samples have been tested so far. Lagos State accounts for the highest number of cases on admission, with over 17,000 positive samples, followed by the FCT and Oyo State. Over 13.7 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while more than 5.1 million of the population have been fully vaccinated. The total global confirmed cases have surpassed 351 million, while deaths are beyond 5.5 million.
And the COVID-19 mobile vaccination team focused on reaching communities on the outskirts of Benin City. The Edo State capital says it finds the compliance level encouraging in one of the areas it visited today. The state's technical facilitator of the local government area COVID-19 mass vaccination program explains that the team set out early this morning to increase its chances of catching the unskilled artisans in the locality before they set out for work.
We had like a mobile team. We are moving from place to place to focus on areas where we have a conglomeration of people. For example, these are brothers and sisters, these are Muslim brothers and sisters there. They come out early in the morning to go look for their daily bread. So we had to come as early as 6 a.m. in order for us to be able to meet them. We vaccinated a lot of them who have already gone to their daily activities. So we still have some that just returned. So we have been here. Far enough, the turnout is okay. It's encouraging. With the help of our brother Sadiq, he can speak their language, so we are able to communicate with them. And I can say the turnout is fine.
Meanwhile, Minority Leader of the Federal House of Representatives, Honorable Ndudu Melumelu, is assuring Nigerians badly affected by the COVID-19 pandemic that they will be accommodated in the 2022 budget. He spoke to newsmen on the sidelines of an event at the Government House, Asaba, insisting that the federal government should provide a register to ascertain the claim that monies were disbursed to many Nigerians to help mitigate the effect of the coronavirus. While encouraging vaccination, Honorable Melumelu insists on strict adherence to both the pharmaceutical and non-pharmaceutical safety protocols as the best way to contain the virus. Meanwhile, the Delta State House of Assembly, through the Speaker, also gave the same assurance to Delta residents, encouraging all not to lose their guard.
My worry in all that they have done is that up to this moment, we have asked, the Minority Caucus have asked for the register of those that they claim were even given the ones that were released. And up to this moment, we have not seen that register. And often and on, they claim, even in my constituency, that some names are beneficiaries. It's difficult for me that even in my constituency, I cannot even know those names. And it is only through the register that we can actually get the accurate names of people that have been that have so far benefited from the sole money that they are doling out. Right now, we do not have a law that makes it mandatory. But I think this is an issue of moral persuasion. That if you are not vaccinated, there's possibility of you endangering other people's lives. So it's a way of persuading Nigerians to, as a matter of safety, to get themselves vaccinated. That does not stop you from contacting COVID-19. In addition to vaccination, Nigerians should continue with the protocols. Wear your mask, wash your hands, and use sanitizer where necessary. These are things that can save us.
You can see that it has reduced because with the laws in place and with adhering to the protocols, the guideline and protocols, see that everything is working well and it has reduced. No more centers again for now. People are already moving freely and they are put on their face masks as advised.
And from Delta, we come to Lagos. While Nigerians prepared for Christmas and New Year holidays at the beginning of December 2021, after crossing over 1,000 daily infections, the Lagos State government confirmed the beginning of the fourth wave of the pandemic. But over the weekend, the Lagos State Commissioner for Health announced the consistent decrease in COVID-19 case positivity, indicating an end of the fourth wave in the state. Well, joining us to talk more about this, Dr. Alera Roberts, a public health physician, joins us now. Thank you for joining us. We understand that you are on your way somewhere, but then thanks once again. Let me get straight to the point. Is Lagos out of the woods, and what can you point to as a reason why cases are now declining?
No, Lagos is not yet out of the woods, but we are clearly getting over the fourth wave. The reason why cases are declining, I think people are being more careful about social distancing, wearing masks, and clearly we're not getting as many symptomatic cases as we were getting before. So we are on the way out of the fourth wave, but we should not let down our guard.
Someone said that perhaps at some point the Omicron is now endemic, such that the population probably has developed antibodies. And this is also, if we put on the other hand, that perhaps not much testing is actually ongoing.
That is true, but we cannot say that people have developed antibodies unless we can test for the antibodies in their blood. And like you said, not much testing is going on. But then people are clearly not having the symptomatic version of COVID. And, you know, people are being more careful about wearing their masks and making sure they don't go into crowded indoor spaces and being more careful about transmission of the disease. There are so many people who opt not to go into any of these events. But that, so people are on their guard. Of course, it does help that our vaccination levels are a lot higher than they are in the rest of the country, and people are getting vaccinated.
To you, what's your take on perhaps testing? What would you be more comfortable with in terms of what states should be churning out in terms of testing on a daily basis? And perhaps what test positivity rates would you be more comfortable with?
I'm not too sure that, you see, the issue of testing for me and for a lot of us is a bit of a controversial issue in the sense that I keep saying that if you don't have symptoms and you have a lot of stuff to get through during the day, why would you go for a test? And if the results are not going to be available immediately for clinical diagnosis or for use, then what's the point? So unless we can get a lot more of the lateral flow tests, which are like 15, 20 minutes and you have a result, the PCR testing, if you're not symptomatic, I don't see why we should force people to go and do it. What is more valuable is that resources can be deployed into making sure more and more people get vaccinated, because then we know that we're protecting them against severe disease, hospitalization, and death.
And of course, part of the mass vaccination drive is the approval for community pharmacists, laboratories accredited to also administer vaccines. And we understand this is happening in Lagos. But tell us, WHO says that the world's poorest continent should not only broaden vaccinations, but also gain increased and equitable access to some of the critical therapeutics to save lives and effectively combat the pandemic. Looking at Nigeria's case, do you think that we are looking at everything holistically and how to really ensure that, we can record 0 cases on a daily basis?
Looking at everything holistically is very good. Doing something about it would be even better. The one thing COVID has done for us in this country, it has exposed institutional weaknesses in the health system. The point is, what are we doing about it? That needs to be strengthened for everybody to get equitable access to effective health care. Just looking at it holistically and wringing our hands and, umming and awing doesn't solve our problem. We need to be able to strengthen our institutional healthcare delivery system to a point where every Nigerian is guaranteed access to equitable healthcare, equitable access to effective healthcare.
So essentially walking the talk. Thank you so much, Dr. Lara Roberts, public health physician, joining us from Lagos.
Thank you so much for having me.
And to other matters, the manager primary health care in Dutse, Mr. Abdul Hamid Ibrahim, has lamented the difficulty in convincing people to get vaccinated. He made the statement when he spoke to our correspondent in Dutse, the state capital of Jigawa. According to him, people's opinions are being shaped by misconceptions regarding the vaccines.
Normally, when we come across of such kind of people, we use our best to mobilize them, educate them, telling them the danger associated with a person who is not, taking the vaccines, whereby it will be easy for him to be catch with this kind of COVID-19, disease. So normally, when we mobilize, when we educate well, they used to accept, and some. You know how people, when we say people, that is one, but our beliefs or our behavior or whatever we can say, we are different. We are not 100%. And some have his misperception saying that he is not, convinced how to take. But later when he saw so many people who are being vaccinated and nothing happened to them, so they will immediately come to take vaccines. So normally this is how we are doing to mobilize people, and they are accepting.
Still to come, South Africa considers ways to ease what's left of its COVID restrictions. Please stay with us. Welcome back. South Africa's Health Minister, Dr. Joe Phaahla, says government is not oblivious of the numerous calls for COVID-19 related restrictions to come to an end, but that will be done with relevant considerations and caution. Speaking to Channels Television in the Northwest Province at the weekend, Dr. Phaahla says despite the fact that more waves have not been ruled out, proposals are being considered on how best to ease what's left of the restrictions.
The issue of opening of sports cultural activities, it's very top of our mind because we are saying that as the situation stabilizes, there must be benefit to the society in terms of economic activities, social activities, and we are working on that. We're working on that. It's one of the matters which in our meeting at our NCCC as Health, together with other sports and culture, arts and culture departments, we have made presentations. There are proposals which are being discussed. At the time when the president is ready, he will make the particular announcement in terms of what the decisions are. But there are very firm proposals in terms of, working with those areas of sports, arts and culture to make sure that they can be careful, gradual, and safe reopening of those activities. So it's on the table. Very detailed plans are being worked upon. When they are ready, you will remember that already in November, we had already given permission that with a maximum of 2,000 vaccinated spectators can be at stadiums. SAFA has already applied that in a few international matches. The PSL felt it is too small. Rugby also felt they are looking at it. But we are discussing with a view towards even more substantial numbers, gradually manageable, and especially when we look at people who are already vaccinated to give more opportunities. So those details are being worked upon. The question of whether, as we go forward, as we stabilize, we are not yet in the endemic phase. We are saying the stability is promising, we're going there, not yet out of the woods. So we're not going to go the direction of, for instance, what the UK Prime Minister was announcing, that's their own strategy. Our view is we must be cautious. Things which have shown to work, let's keep them on, and only when really we can be sure that we are out of trouble, then we can relax everything. But there will be some elements which are important for social life, for economic life, which will progressively get much more relaxed so that they can be more regaining of many aspects of life.
And our South Africa Bureau Chief, Betty Dibia, joins us right now. Thanks for joining us, Betty. Hi. So SA's Health Minister says the country isn't going to go the UK way, but what exactly is happening to the COVID-19 infection in the country?
The numbers, South Africa at this point has crossed the peak of the fourth wave. So numbers are going down. At the moment, fatality figures, from the latest slide, you see a higher number than the daily recorded numbers. Usually when they release these things these days, they accompany that with a notice saying that we have a backlog of fatalities. So overnight or in the past 24, 48 hours, it's actually 10 people who died of COVID-related illnesses. But the backlog from days before and from other provinces, there's a delay. So they add that up to give the daily figure, but it's not exactly what you have for daily, because you may misread that to say, oh, over 100 people have died. So numbers generally are going down, and the restrictions have been relaxed. That was done on the eve of New Year, I think, New Year's Eve. So generally, people are doing things. For schools are back in session, at least the primary schools. But you still have the issue of social distancing, so which many people are still now fighting against, because that has brought the scenario where people don't go to school some schools, the pupils don't go to school every day. So you have the rotation, what they call rotational attendance of school, and the ministry or the Department of Basic Education is trying to say, look, we can actually do away with this at this point, but some schools are still doing that, some are not. Hospitalization has reduced and recovery rate has increased significantly, standing about 95.3% or so. So generally, it's looking good, but the government is still saying we have to be cautious and not just let loose and remove the state of disaster, which makes the government pronounce all these restrictions, which allows them according to the Disaster Management Act.
And still on government strategy, how are people responding to some of the plans of reopening, whether it's spectators in the stadiums, other gatherings, other restrictions that might be eased, that might follow?
They're hoping. You have some of the opposition parties like Democratic Alliance and the Economic Freedom Fighters, screaming and shouting every day. For the EFF, it's the gatherings. The gathering outdoors is 2,000. I think indoors is about 750. But they want more. They want people to be able to go out, to have the freedom, especially those who have been vaccinated. Maybe if more of that is allowed, maybe more people. Now we're standing at about 29.3 million people who have been vaccinated. About 2/3 of that fully vaccinated, not everybody. So they're calling for more. There are many industries that depend on the high numbers. Associated industries to sports, entertainment, and all that. Many other industries have the more freedom now to practice, to do their business. But there are those other industries like entertainment where you want to fill up a stadium and have musicians play. But that is not yet allowed because who wants to play for just 2,000 people? The businesses associated with that kind of business will not do well. So those are the people still calling for all that restriction. Let people get vaccinated, but let more businesses be allowed to operate and allow more numbers and less restrictions.
Tell us a bit more about the vaccination. I mean, looking at perhaps Lagos, for example, they say the fourth wave is over, but then the government is calling on more people to get vaccinated. Now, South Africa is seeing less cases. I also take it there is a call for more vaccinations, and we know how Africa is behind in terms of vaccinating the population. But how much progress is South Africa registering?
Many people have registered, but they haven't gone for the vaccination, even the first dose, or the one-dose one, which is the J&J. Many people. And maybe because recovery rate is higher now, so people are pulling back the vaccine hesitancy, which has been recorded in some other countries as well. It's here. Remember, the target for the country as at last year, they wanted by December to have as many as 42 million people, adults, vaccinated. Now we're still sitting, this is 2022, we're still sitting at 29.3 million. So they're hoping that more and more people will get converted and actually make that move to vaccinate. It's free, you register, you can actually walk in to any vac site. But and then you have pop-up centers as well. The problem that we're recording, and it's been recorded in several places, especially townships, the pop-up centers have been attacked by armed robbers who get in and attack all the people, take laptops, because records are taken centrally. So you have computers, laptops at all these centers, and they hold them at gunpoint, take all their laptops, phones of the people there, the personnel, who are carrying out all these vaccinations. So that's another issue that the government is dealing with on the side. I think one happened on Friday at the Soshanguve township, which is in Pretoria, outskirts of Pretoria. It happened some months back, and different other places that we've seen things like that. So that is another thing, making volunteers scared too of going out. But government is making effort, to secure their safety or secure the pop-up centers as well, and then different other communication channels to encourage people to go out there and vaccinate, because government says it's the only way, to keep people safer and for us to learn to actually live with the virus, the coronavirus.
Thank you, Betty Dibia, our South Africa Bureau Chief there with the latest.
Thank you.
British Prime Minister Boris Johnson says people arriving in England from abroad will no longer have to take the COVID-19 tests if they have been vaccinated. He told reporters today that the rule change was designed to show that the country is open for business and travellers. Here's more on the Global Update.
Hello, good morning. The British Prime Minister has not said when the requirement would change, but further details are expected to be given later today. Mr. Johnson's comments follow a report that suggests that requirement for fully vaccinated travellers to take a lateral flow COVID test within 48 hours of arriving will be dropped.
So, very important point. We have, thanks to the tough decisions, the big calls that we made, and I think most people would agree that we got the big calls right in this terrible struggle against COVID. We have the most open economy and society in Europe, and although we have to be cautious, we are now moving through the Omicron wave, and you can see the figures are starting to get better. So what we're doing on travel, to show that this country is open for business, open for travellers, you will see changes so that people arriving no longer have to take tests if they've been vaccinated, if they've been double vaccinated.
The video was...
The head of the World Health Organization, WHO, said on Monday it would be dangerous to assume that the highly transmissible Omicron would be the last variant to emerge and that the world was in the endgame of the pandemic. However, he said it was possible this year to exit the acute phase of the pandemic where COVID-19 constitutes a global health emergency if strategies and tools such as testing and vaccines are used in a comprehensive way.
More variants to emerge.
Doctors say staff at a hospital in Sofia are struggling as hospitalizations rise and Bulgaria faces record infections. With the lowest vaccination rate against COVID-19 in the EU, Bulgaria reported a new record of 9,874 confirmed infections on Saturday, January.
Healthcare workers are advised to maintain a high index of suspicion for infectious diseases at all times. Visit our website for more updates, a better understanding of the pandemic and other stories. It's channelstv.com. That's our program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.